Hello, my name is Suzanne Roberts and I'm head of the counselling service for the Macular Society. Today we're going to be speaking not only about the impact of macular disease on the person themselves, but also about the impact on their family. And we're very fortunate to have with us Linda, who has dry macular disease, and also her husband Robin. And they will be talking to us about their experience of living with macular disease. But firstly, I'd like to tell you a little bit about our counselling service and how we might be able to help you and or your family. So we know the emotional impact of macular disease is often overlooked, with the focus being placed on visual aids and practical advice, which is all very important, but very few people are asked how they're feeling or how they're coping. There are common fears when diagnosed, such as the fear of going blind, fear of the future, and a general feeling of loss and shock, all of which can be acknowledged, explored, and often made much more manageable within your counselling sessions. So each year, our telephone counselling service works with over 600 people who contact us, often at the point of diagnosis or where there's been a change in their vision, and a change to the point that it affects the way that person lives their life. So basically they have to do things differently. The service is free and confidential, and it's easy to refer. This can be done either online or through our website, or if you prefer, you could call our helpline. And this is for both individual and also group referrals. The criteria is that you or someone you support has a macular condition and that your reason for the referral is linked to the sight loss. We offer an initial assessment which will allow you to talk things through and decide what is the priority for you right now. Is it counselling? Is it another one of our services? Or do you feel that you've actually got what you needed from the initial assessment? As well as the individual support that we offer, we have group work which is available. And firstly, I'll tell you about our online employment therapy group. And this is for anyone who is in paid or unpaid employment who has a macular condition. And this is a set of 6 online sessions. And each week there is a different theme covering topics such as dealing with ignorance and misunderstanding in the workplace, or perhaps what does it feel like to have a visual impairment at work, and looking at ways of increasing your resilience. Next, we have our new online friends and family group. This is for anyone who lives with or supports someone who has a macular condition. Again, it's 6 sessions covering topics such as the emotional impact of sight loss on a relationship, attending to your own needs, and recognising difficult emotions and finding ways to channel them. And then lastly, we have a telephone support group for anyone who experiences the Charles Bonnet syndrome. So that's seeing things that are not actually there, which can affect anyone with eye disease. And this again is a 6-week group, and it allows people to speak to others in a similar situation, share coping strategies, and to reduce anxiety. Now we know having a diagnosis within any family or relationship can impact a great deal on the people around you. Those supporting someone with macular disease will often overlook their own needs and not consider themselves a priority. At the Macular Society, we want to support you and your family, as this will increase your overall strength, hence the introduction of our friends and family group, plus the decision to speak to Linda and Robin today and hear their experience from both sides. But before we move on to Linda and Robin, I'd like to say that everyone's experience of being diagnosed with macular disease will be different. The way you feel, the way you cope, the way you adapt, it will vary because we're all unique and we do what works for us. I imagine that you will notice similarities whilst listening to Linda and Robin, and there will be common themes that you'll be able to relate to. Hopefully what you hear today will normalise some of these feelings and fill you with hope and inspiration that there is a life to be had after a diagnosis of macular disease, but most importantly, for you to know that you are not alone. So Linda, back in July 2023, you made a referral to the Macular Society's counselling service. And I'd like to read out what you wrote on the referral form, as I think it clearly sums up the desperation that you were feeling at the time. I've just been diagnosed with dry macular disease. Although when the opticians looked back in my records, they could see I had it in 2018. I just feel completely lost and devastated, and I can't stop crying. Now, I must say, I really felt and still feel the pain in your wording from reading that. But I wonder if you could just tell us a bit about that day when you went along to the opticians.
Absolutely. I strangely, on the beginning of the week, one of my eyes had gone blurred. So I called the opticians because it wasn't clearing, and got an appointment for the next day, and went in the next day. And by the time I'd gone in the next day, it had cleared, and they checked my eyes and basically couldn't find anything. But I already had a pre-existing appointment for the Friday of that week. So I went back for my eye appointment, my regular eye appointment, eye test on the Friday. And the optician did the eye test and everything, absolutely fine. And then when he was looking through my notes, he asked about why I'd been in on the Monday. So I explained to him, and he said, did they do an OCT scan at that time? And to be honest, I'd never heard of an OCT scan. I didn't know what it was. And I said, no, obviously not. So he said, well, I'd like to do one just to be sure. So he did the scan and came back and was looking through it on the screen. And he sort of asked me to go over and have a look and said, you see this here, this layer is lumpy, and it should be smooth. And I said, okay, what does that mean? He said, it means you've got a condition called age-related macular degeneration. And I said, right, well, degeneration doesn't sound great. What exactly does that mean? He said, oh, it means you're going to go blind. And at that point, my brain stopped functioning and I couldn't think of anything. And I said, I don't understand. And he said, basically, you're going to lose your sight. And he said, so I said, well, what do I do? Is there treatment? What can I do? And he said, there's nothing you can do. There is no treatment. There is no cure. And I said, so what time frame? What am I looking at exactly? And he said, it could be tomorrow. It could be next week. It could be next month. We just don't know. And I said, okay. And he said, I'll give you a leaflet, and if you notice any sudden change, come straight back to us. If not, I'll see you in 12 months. And that was that. And I'll be honest, I walked out and I was just in a complete state of shock because I'd gone in just to have a regular eye test, and I'd come out half an hour later and I'm going blind. And it was sort of late on a Friday, and I just got in my car and drove home. But I was just, like I said, just in a complete and total state of shock. I didn't know what to do. I didn't have a clue what to do.
Can understand your level of distress. Were you kind of given any advice apart from come back if you notice any changes, perhaps? Nothing at all.
I think that obviously looking back now, the way that the news was delivered, first off, just I was reeling, and secondly, There was nothing. And it was late on a Friday, and I literally got home and came in, and my husband said, is everything okay? And I said, no. And he said, what's wrong? And I said, I'm going blind. And he was equally as stunned. And he said, I don't understand. And I said, I've got this condition and I have this leaflet. And obviously I then did the worst thing you can possibly do, which is to then get on the computer and Google macular degeneration. And it's just, all I could find was just one horror story after another. And it was the weekend then, and obviously nothing. I didn't know who to call. I didn't know what to do. All I did all weekend, and it was more or less day and night, because I couldn't sleep. I can't begin to, and people, will know the absolute and total devastation that I felt, because I just grasping at anything, just anything and everything, looking at treatments that are out there and different. I mean, there's all kinds of stuff that, unfortunately, people in my situation would just jump at and grasp at, because you just want anything, you want to be told anything. But it felt like everywhere I looked, there was just a door slammed every time, because there was nothing. And I was just, and I did feel absolutely broken, just totally broken. And the whole just awful.
Doesn't sound like you were given any sort
Nothing.
of hope.
No, nothing at all. I mean, I did over the weekend. Obviously, I then thought there's got to be a society for this, and I found the Macular Society, and that's when I left, etc. for the counselling.
Okay, I think we know from the sort of people that come through to us at the Macular Society that being given a diagnosis and the way that you're given the diagnosis makes such a difference to how that person feels. And also the use of the word blind, because quite often people are told you have macular disease, but you won't go blind. But that person would never have considered any association with blindness and themselves. But yet you were told the opposite. You were told that you were going to lose your vision, but not to give you any kind of anything to grasp onto, as you said. Yeah. So then you did come through to us at the Macular Society, and you made the referral.
Yeah.
What difference did it make to you contacting the society? I assume you would have spoken to the helpline, and then you've come through to the counselling service. What difference did it make to you?
Oh, they were just wonderful. I mean, I spoke to, I'll be honest with you, when I spoke to the helpline, and they were fabulous, and looking back on it, but I think by that stage, I'd spiraled. I mean, I had just spiraled out of control then. All I could think about was blindness, everything. And they answered what questions I had, but I was looking for, they weren't giving me the answers I wanted. You just want a cure. You just want somebody to say, oh, well, we can do this and we can do that. But they were lovely, and they were very patient with me and very thorough. And then when they put me in contact with the counselling service, I'll be honest with you, I mean, it absolutely saved my life, and it really did. Because when you're so consumed with this whole, what you've been told and what's then by that time ingrained in your head, and it's life-changing, because you don't know what to do, and you need somebody who can basically talk you down and bring you back in to reality. And it was hard to begin with, and it was tough, because I just cried all the time. I mean, it was just awful. I just cried all the time. And it was straight when I spoke to you, and when I was on the phone to you, it was the few times that I actually felt like it was a lifeline. It was somebody secure, and somebody who knew, and somebody that understood the condition, and it was reassuring. But it is a very, it is a slow process. It's not something that's going to happen overnight. And there were things that I was terrified about. And to a certain degree still am, the what ifs and the not knowing. But it absolutely, the whole counselling service and the counselling I received it changed my life, because at one point, it felt like life was over. I mean, everything in my head, I was never going to be able to see my children or my grandchildren or my husband or even myself. You know, what do I do? And all these things, and it was going to happen. It wasn't a, you know, if or maybe, it was it when and it will. And it changed my thinking on things. It made me say, well, if this happens and you know, maybe, blah, blah, and it just helped to change my perspective. Obviously, the is what it is, but at least you can get your head in the right place.
Mm-hmm. And I know that emotionally you are in a much better place than you were a year ago.
Absolutely.
What would you say to people listening who might be newly diagnosed, who've experienced a drop in their vision and might be finding life quite tough right now?
And it is tough. And I'm sure, I mean, I still have dark days, and I have days where I you know, get inside my own head and everything's going to be dreadful. But you do find ways over time to talk yourself down. You know, you don't need somebody else to tell you. You can find ways to just rationalize things and put things into perspective and etc. And it is a very, very traumatic time. There's no life will change. Life does change. You know, and it's changed me, and I wouldn't say it's not changed our relationship, but we have to think ahead on things now. You know, we have to do things sooner than we think, because we don't know. The worst case scenario may never happen, but you know, you just have to change your way of thinking. But it's kind of you have to try to not think about the what ifs and think about the what is. You know, and how am I in this moment? How are we in this moment? I'm good. Everything's good. Everything's functioning fine. Then let's just push on with life and let's just do what we need to do. And then if anything happens, or if there is a sudden change, you know the support's there. When I was first diagnosed, I was totally alone. Felt totally alone and isolated. But now I know there are people out there, and there's help out there, and there are aids and things that you can be given and help with. But it's for me, the emotional side of things is far and far more important. I know that I've got help out there. I know that somebody will hold my hand at some point and tell me that
most definitely
it's going to be okay. You're going to be okay, and you will be okay. You've
done amazingly well, and you've got Robin. So I want to be able to include Robin and just ask you, what was it like for you when Linda received her diagnosis?
Devastating for her. I mean, I felt devastated for her because, you know, normally anything we've come across in our time together, we've been able to deal with, right? You know, because we have a good partnership. So this was totally something that was alien to me, because I was angry, I was helpless, I felt helpless, I was confused, because any issues that we've ever had or whatever, we've just dealt with. You know, we're quite fortunate in that way, and this is something that I had or not just me, but from my perspective, had no control over. I could not. There was nothing that we could have done. And I remember that Friday night like it was yesterday. Yeah. Really tough.
Yeah, and there was a lot that you did do, Robin, I suppose. Even though lots was out of your control, there was a huge amount that you did do, and working together as sort of a fantastic team. Did anyone ask you how you were, Robin, or how you were feeling?
No, one person. Just my niece. No one really, because you know, and it was all about Linda. You know what I mean? Not when I say all about Linda, but you know what I mean. She's the one that's been diagnosed, so everyone was asking her how she was and whatnot, and sort of, you know, and no, they didn't. It was like, you know, she's the one that's been diagnosed, not you. So we'll we'll deal with you. It's like, I know, it's just a shadow on the outside, which is, you know, I don't know, I guess you expect it, but yeah, and then, you know, yeah, no, they didn't, to be honest.
But as you said, you felt the devastation that Linda felt.
Yeah, of course. I mean, you know, it's nothing worse than watching your wife and someone you love sitting there totally in tears and crying and trying to console her and everything I did wasn't helping. Do you know? I guess it was, but to me, it was like I couldn't do the right thing. You know, and it's like, and I guess you learn quite quickly that there's a boundary that you can go to, and you have to be firm. You know, I learned that, you know, normally, you know, we're equal, but sometimes I had to go no, and you know, and be brutal, because if not, I think it would, you know, without the counselling sessions, I don't know how we'd have managed, to be honest.
You did, and you have managed amazingly well. What would you say, Robin, to anyone in your situation who perhaps wasn't quite knowing what to say, what to do? Are there any sort of little tips or strategies?
Yeah, listen.
Great.
Look for the signs that when to talk and when not to talk. You know, and just I would say, be sensible and look at the situation. You know, there's times that you can put an arm around somebody and give them a cuddle, and there's times to say, right, come on, pull your boots on, let's go, we're doing this. And you have to pick your moments, but you get there. You know, you do, we do. And I've said things to Lynn, come on, we're going out. We're going out. We're not doing this no more. And get in the car, we're going out. Even if it's first. And afterwards, you know, she'd say, I needed that. So
that's great. That's great.
It's about picking your moments.
Picking your moments, finding a balance, and sort of living in the here and now.
Yeah. I think for me, it's more about half full than half empty.
Yeah. You're a very positive influence.
Yeah. So
before we sort of close the session, I want to say sort of a huge thank you to you two, because if it wasn't for people like you sort of sharing your story, we wouldn't get to hear it. And it's emotional, it's heartwarming, but hopefully, you know, it fills other people with hope and inspiration that there is life after a diagnosis. But we're also acknowledging that it does affect other people in the family, you know, not just the person themselves. So massive thank you to you two. And also, you know, I should add, really, what you've spoken about makes it real.
Yeah.
And it makes the work that we do at the Macular Society real. And I think that's what people want to hear. Absolutely. So, yeah. And thank you to everybody listening, and hope that everybody goes on to enjoy their day and enjoy the rest of the conference. Thank you.
Thank you.